So welcome to RAAONLINE. I am Dr. Jay Kumar, Associate Professor, Department of Pharmacology, and today I will take you through the chapter on mood stabilizing drugs or anti-maniac drugs. So the competency here is describe the mechanism of action, uses, adverse effects of mood stabilizing drugs, and basically we are going to discuss the one particular drug, lithium carbonate, which is where since in old days this drug has been used for the treatment of mood stabilizers, and there are some newer drugs came into the market for the treatment of mania, and this particular lithium carbonate is very important. So introduction, here the pathology, mania means it is a excessive desire and too much of euphoria. So if you see these person, they will be always in a high-fi mood, like euphoric symptoms. Okay, so that is why it is a pathological excitement with racing thoughts. The thought process will be very much fast actually, and there will be a pressured speech, and as a result they don't have time to sleep at all. So that is the character of this particular maniac patients. And what is the pathology behind here? There will be increased norepinephrine levels in the brain. So when there is a norepinephrine levels is increased because of the sympathetic overactivity, and you are getting the signs and symptoms. And sometimes the patients will have also associated conditions like depression. So depression, for example, one spectrum where the mood will be a little bit affected, and here the maniac, the mood will be elevated. So they fluctuate between these two, and that is why the condition called bipolar maniac depressive psychosis. So this is one important conditions, and one particular drug which we are going to discuss is lithium carbonate. So coming to the lithium carbonate, if you take the history, lithium carbonate, it has been used as a table salt. In 1940s, it has been used as a table salt for treating for the hypertensive patients. The reason why is lithium is a monovalent cation, like similar to sodium and potassium. So what happens when you take lithium? The lithium goes inside the renal tubules, they get absorbed, and sodium get excreted, and that it can be used instead of the sodium salt, you can use lithium salt like lithium chloride. But what happened? Two problems happened here. One bad problem is that the person who took the lithium chloride, suddenly they started having toxicity and death also noted. Okay. And the second reason is when they use this lithium carbonate, especially for the hypertensive patient along with maniac depressive psychosis patients, they found out that the depressive or the psychosis symptom has been little bit settled down. That they observed actually. So one good thing happened, but other bad thing is lithium toxicity occurred, and then because of that so many deaths happened. So they withdraw the drug from the market. But later on, what they thought is they brought back into the use as a treatment for the maniac depressive psychosis. But again also there is a problem of toxicity, some death happened, but they don't know what the reason exactly. Till in 1960 or mid 1960s, they found out that the lithium, the concentration should be maintained in the plasma in a narrow range. So that is the main important. So when you maintain the lithium carbonate concentration at a particular range in the plasma level, then there was no toxicity, and it was quite useful in case of maniac depressive psychosis. Then it started using in the market for quite a long time. So coming to the lithium carbonate, the pharmacological actions, if you see what happens in the central nervous system, they inhibits depolarization provoked and calcium dependent release of norepinephrine and dopamine, but not serotonin. That means normally if you say in the presynaptic nerve terminal, what happens? There will be a calcium channel will be there. So the calcium entry should be there, and the neuronal impulse should also be there. Then only from the vesicles the neurotransmitter will be released. Okay, so it inhibits that particular calcium dependent release of this neurotransmitter, norepinephrine and dopamine. So I told you the pathology in case of mania is excess norepinephrine release or decreased dopamine. Okay, so if you control the norepinephrine levels, then the symptoms and signs of mania will be controlled. But what happens in case of normal individuals? It doesn't have any effect at all, and it is neither sedative nor euphoric. So the second organ is the system is the kidney. What happens? This lithium carbonate, it inhibits the action of ADH. ADH is nothing but anti-diuretic hormone. So when you block the action of the ADH, naturally there will be a diuresis will be happening. More urine output will be there, and there is a condition called diabetes insipidus. And in endocrine, it has got an insulin-like effect. So you have to be very careful. It can cause hypoglycemia. So when a patient is on a diabetic drug, anti-diabetic drug, you have to be very careful. If you want to prescribe lithium, they might have a severe hypoglycemia because of the insulin-like action for lithium carbonate. Then the other thing is, it decreases the thyroxine synthesis by interfering with the iodination of the tyrosine. This is one particular step in the formation of the synthesis of the thyroxine hormone. So when it decreases the thyroxine synthesis, what happens? The patient will go in for hypothyroidism. Then it also increases the leukocyte count. That means leukocytosis can occur. So these are the other pharmacological effects